cause of fever in outpatient Tanzania children. As the incidence of malaria minister a better understanding of malaria fever is important for effective management of illness in children. This study we explore the spectrum of causes of fever in African children.
Malaria is an infection with one-celled protozoans called plasmodia. Plasmodia spend some stages of their lives in female Anopheles mosquitoes and some stages in people. A female mosquito sucks in plasmodia when she takes blood from a person infected with malaria. In her intestine, male and female forms of plasmodia combine into zygotes. Zygotes burrow into cells in her intestine and form tiny cysts. Within each tiny cyst, the zygote divides many times. Eventually, the tiny cyst bursts, and plasmodia migrate to the mosquito's salivary glands. She can now inject plasmodia into a bide. The liver cells eventually burst, releasing thousands of plasmodia back into the bloodstream. The parasites next invade red blood cells, where they divide again. They release more plasmodia, which in turn infect more red blood cells. Each time the red blood cells rupture, the person suffers an attack of chills and fever. Some of the plasmodia eventually develop into male and female forms, ready to infect another mosquito and continue the
We recruited children to bear that 10 years of age with a temperature of 38, no sé cómo se dice eso, of either age 2 outpatient clinic. One rural and one urban in Tanzania. Medical story were obtained and clinical examination conducted by means of a systematic procedure. Blue and nasopharyngeal specimens were collected to perform rapid diagnostic tests, serologic tests, culture and molecular tests for potential pathogen causing acute fever. Final diagnoses were determined with the use of algorithm and a set of precise criteria. This resulted provided a description of the numerous causes of fever in African children into representative stating. Evidence of a viral process was found more commonly than evidence of a bacterial or parasitic process.
Sickness. I don't really know very much about it actually though.
That's mosquitoes.
Yeah. Is it affect people in like foreign countries?
Yeah.
I know it's like I think it's like a disease or something. It's a disease.
Malaria is a sickness.
It is a viral disease that's transmitted by mosquitoes.
Everyone that has mosquitoes, I would assume.
Millions. Pushing billion.
couple billion, maybe.
Thousands of people. Malaria is half of the world's population, 3 billion people. Tonight, 2,000 children will die from mosquito bites.
Malaria largely affects the poor. It slows economic and educational development, perpetuating the cycle of poverty. We know how to end malaria. 60 years ago, malaria was a major killer in the United States. It took 5 years to wipe out malaria in the United States. When made a priority, malaria can be stopped.
Pros and cons. Cons, no pros. Anemia, bloodies, chills, coma, seizures, fever. Jointise, muscle pains, shakiness, headache, vomiting.
Created using Powtoon.
UCSG. Encephalitis literally means an inflammation of the brains. In most cases, this inflammation is caused by a virus.
Encephalitis is an inflammation of the brain. It can be known as an acquired brain injury. There are many types of encephalitis, most of which are caused by viral infection. Symptoms may include the following: confusion, drowsiness, headache, irritability, light sensitivity, loss of consciousness, memory loss, muscle weakness, poor judgment, seizures, stiff neck and back, sudden fever, sudden severe dementia, unstable walking, and vomiting. The prognosis for encephalitis varies. Some cases are mild, short, and relatively benign, and patients experience a full recovery. Other cases are more severe, and permanent impairment or death is possible. The acute phase of encephalitis may last for 1 to 2 weeks, with gradual resolution of fever and neurological symptoms. Neurological symptoms may require many months before full assessment can be made. Some individuals may have permanent disability. Others may experience some loss of brain function. Encephalitis can be an invisible disability. The information in this video is intended as a general information discussion guideline only and should never be construed as medical advice. For further information,